Hi again, my name is Ian. I'm the Assistant Group Chief Technology Officer for the National University Health System, which is a group of hospitals in Singapore. I'm also a practicing emergency medicine doctor. I want to share with you a little bit about what we do in the emergency department in terms of AI and our capabilities, as well as what NUHS as a whole is doing towards AI. I think they asked me to speak today because they perhaps think I'm artificially intelligent. But a little bit about the NUHS. So it's a group of hospitals, primarily 3 hospitals in Singapore, as three tertiary hospitals in Singapore, as well as primary care facilities and community hospitals. We also work very closely with the National University of Singapore and the various departments within the National University of Singapore. The entire health system has about 2,650 beds, and we service pretty much the entire west of Singapore, or whichever patients in Singapore or the world want to come and see us. Some quick facts. NUH itself, National University Hospital, is the flagship hospital of National University Health System. It opened in 1985, and it was the first restructured hospital in Singapore. And it's the only public hospital that has all specialties under one roof. We can treat children, adults, women, specifically women's issues. We're the only hospital in Singapore that can do all of that. And we have an academic mission to not just treat patients, but to teach the next generation of doctors as well. Per year, we see about 1 million patients walking through our doors, and we've got state-of-the-art facilities. So, since we're talking a little bit about AI, can anyone recognize where this image comes from? Okay, a couple of people can. What if I add this line to it? Is it getting a little bit more familiar? Or maybe this, an iconic scene from this very movie, 2001: A Space Odyssey. Now, this movie is actually 40 years old, and the book is even older than that. AI is not new. It has been around for a while, and this is an AI summit, so I'm not going to bore you too much about what artificial intelligence is, but some key points that you want to think about is decision making. Humans are uniquely capable of reacting in a given situation with new knowledge provided to us. So is artificial intelligence then capable of providing this for us? And again, I won't bore you, but a few key points of AI that I want you to think about as well is that it's not subject to fatigue, focus, and memory. And AI has the ability, or machines have the ability to learn in multiple dimensions. The aim we have for AI in our health system is not to replace doctors, but to augment and support doctors in critical decision making, not replace them. Our changing world is full of more and more data on a daily basis, and we've got stronger and better computational power. But in healthcare specifically, we have huge amounts of data being present to us via mobile apps, via wearable devices, via social media, via various forms of test results and home monitor systems. And we know that AI in healthcare is a field which is growing. There are many papers that are published annually in AI in healthcare, and you can see that it has grown in the last 5 years. Startups developing AI systems in healthcare have peaked, and in the last 5 to 10 years, AI course enrollment has grown, and annual VC investment in AI startups in the healthcare space have grown significantly as well. But all this data that we have can potentially be just a data dump. How then do we turn this precious hospital data, patient data, into true gold? That's where data analytics and AI comes in for healthcare. Just as a snapshot, AI for healthcare is huge. Just looking at AI for radiology alone, there are 2 trillion new images every year in radiological images. And this is expected to double every 5 years. And if you're worried about the cost of AI in healthcare, AI pays for itself. This is the potential cost savings in various aspects of AI. It's a total of $150 billion a year of cost savings for AI. It doesn't cost that much to implement programs in healthcare settings. But despite all this development, the World Health Organization describes 10 threats that we are seeing to global health. Now, if you look very carefully at these threats, and you compare them to what we potentially see in some of the challenges of 21st century healthcare, you can see that all this is rife for a digital disruption in the healthcare space. Now, healthcare has moved a little bit slower, but for good reason. We can't be an industry that moves fast and break things. We have to have the patient in the center of our minds as we do things. Now, with NUHS itself, we also had some challenges when we wanted to embark on implementing and developing AI. Firstly, we had multiple sources of data that didn't communicate with each other very well. We had a large amount of messy and missing and noisy data. Of course, in healthcare, there are many different coding standards around the world which provided challenges as well, and others such as new electronic medical records which were coming up, and every hospital having a slightly different electronic health record. So, because of that, we developed something that we call Discovery AI. Now, Discovery AI is a platform which we developed within the National University Health System. It's a very complex picture, but I'll try to explain it. So, we have basically a multiple layer platform in which we have data coming into us, and on that same platform we can do data analytics. So it is a single platform in which we can provide data analytics as well as clinical AI tools. Part of it is the storage from the various clinical databases. Part of it is a research layer that we provide for want-to-be researchers in our hospital system, as well as a production machine which we are developing clinical AI tools on. As I mentioned, it's a production level sandbox that we're allowing our clinicians to play with for now, but we're implementing very soon. Multi-layer system, one layer for our electronic health record and another layer for our clinical AI tools, with the principles that we try to create of data equitabilities, security, privacy, and oversight. And we can do this in multiple domains, not just for clinical care, but for operations, resource allocation, and community care as well. Again, it's a single continuum in which we can develop AI models on our clinical platform. With the whole development, it actually allows doctors to spend more time with the patient. The computer does the analytics in the background, and the doctor can actually look at the patient when there's a consult going on. The grand scheme of things, we want to make this live. In other words, new patients that are coming into us, how do we do data analytics on the go? So this is our grand plan. We've implemented pretty much the top two and are ready to go live. We are now in talks with the Ministry of Health to get the bottom layer in place. What does this actually mean? So this is our data trunk system in which patient data can be transported between Discovery AI, which is our storage platform that I told you about, as well as Endeavor AI, which is then going to be our production platform. So live data is going to feed in to from patients that we see, is going to feed into our Endeavor AI. The analytics is going to be done and trained on Discovery AI, and the output is going to flow back live to patients. I'll show you a couple of examples. A couple of things that we are trying to develop in NUHS itself, and we have come some way with a lot of them. Firstly, an automated diagnosis of appendicitis. I'll talk a little bit more about this later on. And I'll talk a little bit about our readmissions prediction, which we are doing. We're also looking at disease progression modeling for chronic kidney disease. In other words, a patient with a low level of chronic kidney disease can come to our center and we can predict when the decline in his kidney function is going to be. From then, we can better allocate resources for those. So let's start off with appendicitis. Now, I'm not sure whether many of you know what appendicitis is, but it's an inflammation of a small part of the intestine, a part of the intestine that we do not need in adults, but it causes severe pain. The problem and challenge is that many other diseases cause pain in that same area, and is left to a clinical diagnosis. Doctors are fairly good at diagnosing appendicitis clinically, but because of new training systems of clinicians, more and more doctors are relying on CT scans to diagnose appendicitis, when it used to be a clinical diagnosis. And of course, in certain age groups, we would recommend a CT scan, but in a young person, who is coming in with classical pain. Our clinicians are telling us this is appendicitis based on what we have learned over years, but maybe we're a little bit afraid to make such a decision for our patients because of medical legal climates and the like. So we then created an AI tool that could predict appendicitis based on the free text doctor's notes. In other words, a patient comes in, and based on what the doctor is typing into his notes, such as fever, abdominal pain, and various other symptoms, it would then give us a prediction of the likelihood that this patient has appendicitis. Now, how we did this? As one of the speakers earlier on mentioned, before you talk about AI, you need AI to answer a question. The same thing for medicine. You need to define your clinical problem first. What is the problem that you want AI to solve? That is followed by data extraction and refining of data, a process which takes a large amount of time. We then move to the exciting part, which is data analytics and model validation, before we provide the human interface to try to understand firstly what the data is analyzed, and to now present this analysis to patients. And then it's clinical deployment of the tool. So for appendicitis, the problem that we found was that too many doctors were doing CT scans. So then we created a tool which read the doctor's notes, as I had mentioned, and came up with a diagnosis system. If it was a high probability of appendicitis, it would prompt to say, high likelihood, suggest operation, versus low likelihood, send the guy home, he can observe his pain at home. Or, this is the group that should be scanned because we are not really sure whether this is appendicitis or not. So it was a clinical decision tool that was helping us in our decisions. What we found interesting was that AI was as good as 72% in diagnosing diagnosing appendicitis. Clinicians were 87%. But the combination of doctor plus AI pushed that level up to 92%. And this is for appendicitis, which is still fairly easy to diagnose. Can you imagine how much we can potentially shift the needle in other more difficult diseases? We also have a readmissions platform in which we can prompt the clinician before sending a patient home to say, there's a high chance that this guy you want to send home may be readmitted to hospital in the next few days for a variety of reasons, such as maybe his sugar is not very well controlled, or he's on too much medication. It doesn't mean I keep the patient for longer in the hospital, but then I can attribute resources to correcting these before sending the patient home and preventing him to come back to the hospital. Now, what are some of the other areas for AI in healthcare? I'm going to go through this pretty quickly, but these are real live examples of what people around the world are doing. I've split them basically into 4 areas, but with AI in healthcare, you can create your own way of segregating these. So in terms of diagnostics, there are AI tools, basically in the imaging space, that can rapidly detect strokes based on a CT scan, faster than the radiologist can report it. We can also do this for rapid chest X-ray diagnosis, so to allow the radiologist to have more time with the patient than behind the computer screen. And of course, other radiological diagnoses. We can also very quickly, with AI tools, analyze electronic health records, such as determine if there's a new communicable disease outbreak. If my hospital and NUH is seeing various forms of communicable diseases, and they realize a peak in a specific disease, we can then compare that with other hospitals and see whether this is something within the region. Of course, in the area of pediatrics, there are some AI tools that are doing facial analytics for genetic disorders. In terms of predictive tools, we have AI which can predict epilepsy and the onset of a seizure. AI can also help determine which patient is more likely to be compliant to his diabetic medication versus other patients. And this allows, again, channeling of resources to those patients. And of course, we talked about kidney function deterioration as well. In our local setting, one of the things that we are trying to do as well is an AI-based stratification of cardiac events. In other words, a sick person comes to the emergency department. Based on AI tools, I can now determine what his likelihood of having a cardiac event in the next 24 to 48 hours is. For personalized tools, personalized medicine, This is primarily in the oncology and palliative care space. Instead of hitting every single cancer patient with the same kind of drugs for the same demographics, I can now provide more accurate, more personalized medication, which will be right for him and at the appropriate doses. Something else in personalized medicine which is useful in the emergency department, which is useful in pediatrics. The University of, I think this is UCSF, is trying to develop a tool that is converting brain waves or brain signals into speech. So based on what the patient thinks, it can then tell you what the patient actually, for a patient who cannot speak, it can tell you what the patient really wants. And of course, for administrative tools, we can then allocate resources in areas where we know there are high peak flows of patients. We can better schedule appointments for patients to avoid appointments too far apart. And of course, value-driven outcomes. We can potentially reduce costs for the expensive treatments that we have by providing appropriate care. Now, what are others in Singapore doing? So I'm going to talk very quickly about 4 startups in this space that are doing really well. First is BotMD. BotMD the founders realized that there's a huge knowledge explosion and that medical knowledge will double every 73 days by 2020. We have a huge amount of knowledge already. Can you imagine this doubling? How do doctors keep up? So they created an AI assistant for doctors, which will provide clinical answers instantly at the fingertips of doctors. So I can type in any query. What dose of Panadol should I give? And it will provide me with the answers. For example, what dose of this medication in this condition? It can also provide me various medical calculators, which instead of having to think of all these things and try to recall it, I can actually have it at my fingertip. And for pediatrics, knowing that children use different resources, and for a child, the drug dose may be very different for an adult. I can't remember all these offhand. I can turn to this tool. And of course, the latest clinical guidelines will be on the system as well. Videos showing how things are done. Currently, they're in about 60 countries worldwide, but importantly, they are Singapore grown, and they're doing very well in the region. You can download the app. I have no conflict of interest in this company, just declaring it up front. But I use the app myself. The next is Smart Peep. Just to declare, I'm an advisor to Smart Peep, but I thought they're doing something really novel, which is trying to revolutionize elderly care using AI, using video analytics. So again, a Singapore-grown company, but they have got 2 good use cases. One is video analytics for falls in hospital or at home. But not just are they diagnosing falls, because that's easy. The patient has fallen. I don't need to diagnose it then. How do you then prevent it? So they're looking at video analytics that can potentially predict prior to the fall that a patient is exhibiting pre-fall behavior based on the way he's acting or how he's fiddling with the side of his bed rail. And then you can alert the nurses to attend to this patient before the patient actually falls. And it's good for home use as well, basically a fall detection and fall prevention device. The next, again, another company that I'm assisting is Avis Medical. They are creating a wearable device for pediatric use now, but potentially scaling to other respiratory conditions to monitor respiratory conditions in pediatrics. In other words, a device is worn by the child, their first product is in asthma, and it can detect the onset of a wheeze using sound analytics before the doctor can even detect the onset of a wheeze. That's how precise they can detect the sound. And how that helps the patient is that it can allow the parent to provide treatment immediately rather than waiting for it to get too severe when the parent recognizes the child having an attack, needing hospitalization. So they're doing real-time data collection, and we have a lot of powerful insights that we have found from our device. And the last that I want to touch on very quickly is a company called NEFTech. Again, no conflict of interest here, but I thought they're really cool. We have a huge kidney dialysis problem in Singapore. A lot of our patients have end-stage renal failure, and the access for these patients is via something known as a fistula or a graft. In other words, you poke a fistula or a graft to let blood come out of the body to dialyze it before pushing it back in. The problem is this is the lifeline for many such kidney patients. And if the more you poke the graft, the faster it can be damaged. What they're essentially doing is trying to detect this damage very early, so I don't have to wait till a critical stage when the patient is in an extreme condition and I need to poke it and I can't access it. So I'm finding this out early and I can put alternative measures in place for such patients. So those are some of the companies, but in conclusion, the AI in healthcare has huge potential. It keeps learning, it keeps getting better. It can actually reduce human bias and reduce the gap between rich and poor to democratize the economy. Some of the challenges that we face are still global challenges of data storage. Ownership, who owns all this data? Does it belong to the patient or the doctors who are trying to help other patients by analyzing this data? What about some legal issues on trusting a computer versus a physician? And of course, barriers to adoption. Are these all friendly to physicians? So, some of the suggestions I could make are that we need better global collaboration to break down silos. We need to make AI user-friendly for clinicians because doctors are all still very old school. And we need to improve governance and ethical direction. And we need a lot of cross-collaborative support. In closing, I would just like to use a quote from Kai-Fu Lee. I'm sure many of you know who he is. AI will do the analytical thinking, while humans will wrap that analysis in warmth and compassion. Ladies and gentlemen, as much as we can utilize AI tools for our patients, patients still prefer to sit next to a doctor and share the problems with him. So now our role can become improved with AI. They do the analytics, we present it to the patient in a warm and compassionate manner. Thank you very much.